midst of a deepening opioid
Evidence
crisis, the
that the
death
shooter was suffering from mental illness was identified.
County.
Neighbors of all ages, from all walks of life, are struggling and dying every day in our county. Countless families are suffering and don't know where to turn. The behavioral health, addiction, and opioid crisis can no longer be ignored. We need to make a difference together. Today, healthcare is not only provided within the walls of the hospital, it reaches far into the community. This means having the very best care close to home, so that neighbors and their loved ones do not have to travel far. This also means treating the whole person, not just the disease. With early support from public and private partners, Upper Chesapeake Health is introducing the Harford Crisis Center, a program that will be the first of its kind in the state of Maryland. This center will bring together community partners and stakeholders with a shared vision to provide education, support, resources, and hope to our neighbors during their time of need. Our community healthcare mission has never been so important, so powerful, and so worthy of your investment. Your health, our mission. Caring for our families together.
So our capital campaign, Your Health, Our Mission, is really broken out into two main areas. One is the continued support of areas that the community has very graciously supported in the past, around Cancer LifeNet and the Senator Bob Hooper House, which offers palliative care to our patients. And again, those are all services that we need to continue to support, in addition to innovation, which will continue to frame how we access care for our patients. And then the second piece for this is an area that's new to us. It's around behavioral health and really looking at some of the gaps that we've seen here in the county in providing that service.
We had a big seminar a few years ago. We had 65 individuals that attended and began to format what our vision would be for a crisis center and where it would be located and how it would begin to help and stem the tide on this, not only the opioid crisis, but the behavioral health issues that we're all facing with today.
I think that healthcare in general and a hospital in general and these services are really the center point and should be the center point of any community. And when we can provide these services to the folks who live in this community, I think it makes a richer experience for everyone.
We in medicine have always worked under the fantasy that if someone gets sick, they go to a doctor and they get better. That has really only ever been the case for the most simple of conditions. As with cancer, these behavioral health conditions require more than that one individual visit. They require a team of professionals, a system of care. The Crisis Center will be a single point of entry. It'll be a physical location where individuals can come for evaluation, triage, and care navigation. But also it will serve as a focal point that will allow us to help coordinate services across the county. It will fill the gap like Cancer LifeNet has, that will provide a team of professionals that can help individuals navigate a difficult to pass system.
This crisis center is really a linchpin toward getting people the service they need in a location that is off the hospital campus. A lot of people don't want to come to a hospital unless they absolutely have to. So this crisis center, what it will do will move people with behavioral health issues away from the strokes and the heart attacks and the compound fractures, and really put them into a location where dedicated services geared toward their needs are being met and being delivered.
Developing and operating a crisis system is very complex, and funding a crisis system is complex, and no one entity can do it alone. It takes a public-private partnership to make this happen. And what that means is public entities like Harford County Government, Harford County Health Department, and private entities such as Upper Chesapeake Health, Healthy Harford, Office on Mental Health. Lots of our stakeholders and partners in the community have collectively come together to creatively fund the Crisis Center.
I knew that we needed to have a crisis center for the opioid problem in Harford County, and also for people with behavioral health, because all these agencies are out today, Family and Children's Services, SARC, they're all behavioral health issues, and it starts with the family.
I could just imagine if you're a parent or if you're somebody that is in the middle of a crisis, what do I do? And before it was going through a binder like this and find that one phone number and hope that there's somebody on the other end of the line. And now we know that there will be somebody on the other end of that line, and they'll be able to advise as to where to go.
Only a small percentage, less than half of people who suffer from behavioral health conditions actually get treatment for them. It is very hard for individuals or families to find the front door or the appropriate treatment for any of the conditions from which they suffer. Harford County needs a crisis center like every other county in the country needs a crisis center. We need it now, we've needed it a long time ago.
Folks are not quite willing to talk about the behavioral health issues that they may be familiar with either in their family or through extended acquaintances. But in my particular case, again, 5 siblings in my family, and both of my sisters have passed away from substance abuse. And when I think about the anxiety and the stress that put on my parents, both as my sisters were growing up and then as adults, the fact that, again, we've been able to generate support from our community to mobilize around that. That's what's so special about what we're doing with our crisis center and what we're proposing to do with our capital campaign on Your Health, Our Mission. What I'd like to do is to thank the many generous donors that have helped us with Your Health, Our Mission and our capital campaign, because it's couldn't be possible without their support. And when you look back at the rich history of University of Maryland Upper Chesapeake Health, this community and so many donors, whether it's a small $5 gift or whether it's a multi-million-dollar gift, have brought a level of service, whether it's around our Kauffman Cancer Center or Senator Bob Hooper House or a cardiac catheterization lab, that benefits this community in such a way that we oftentimes take for granted until you need it. And the fact that we have such a supportive, engaged medical staff and rich group of volunteers, including our Ladies Auxiliary. Our board of directors is all volunteers made up of community members. And the thanks for them is, just can't say thank you enough, because it's their level of support and their level of commitment and their support of our vision that really has made University of Maryland Upper Chesapeake Health the successful organization that it is today.